All right, good afternoon, everyone. Welcome to Module 12C. I will be talking about safety, prevention of infection, prevention of injury, all these things summing up to just to say one thing, putting safety first. Health safety, physical safety, emotional safety, while like we are not limiting what our the word safety means. Safety from harms, from danger, from pests, from every form of harms. So today we're talking about personal safety. Now we'll be discussing how to help our patients prevent disease condition, how to help our patient prevent fall, how to prevent choking, how to prevent the lives for patients. What about ourselves? Personal. So though we've mentioned a few times using gloves prevents widespread of infection, both from you to patients and from patients to you. But right now we're discussing personal safety. What is personal? Of course, having to do with the person, and what is safety away from harms or dangers. So now, without wasting much time, we'll move quickly to the introduction or the meaning of personal safety. Now, it is important for home health aides or personal care aides to take precautions to keep themselves safe while working with the community and in the patient's home. Now, they should follow these guidelines to protect their safety. So, we know that sometimes may think, why is this important? What, safety is very important. If you are not safe, you cannot make a patient safe. Like it takes me to be safe to save a patient. So if your safety doesn't come first, the safety of a patient is not guaranteed. So always know the route. That's the first way to keep your one of the guidelines to help to protect yourself from danger. Always know the route of the route. You have maps and directions with you and know where you are going in advance. You may get a call to attend to a patient in a place you've not been to for the first time. Now, get good, thank God for the improvement or development in the world of science and the world of technology. That we have maps and Google direction, route finders, and everything. So you can make use of these directions and maps to help you. You should know where you are going in advance. Don't just go there and start looking for where you are going. Because right, even if needed, call the patient for direction or obtain them from the agency prior to leaving for that destination. Now, two things can happen. Either you get missing or you get stolen. How do I mean by get stolen? No, it's very obvious of you to see someone who is new in a place because you look new and look confused. So you are exposed to a lot of risk at that position. So you must know where you are going before you leave home beforehand. And if you have a cell phone, keep it charged with you. Do not use it while you are driving. Uh, Phone and driving. Now, if you are the driver, that's when this rule applies. Don't use your phone while you are driving. Of course, it doesn't mean that you can't use your phone on motion. If you are not the one driving, fine. You can use your phone as much as you want. But then, if you are the one driving for concentration's sake, do not use your phone. They do not take unsafe shortcuts while driving or uh, walking to and fro from a patient's home. Neither alter your route without telling that the agency you are working for. Always inform a supervisor about your whereabouts. Observe surroundings at all times and remain vigilant. That means remain watchful. Do not become distracted by talking, maybe listening to music or using a cell phone. No distracted driving. But why? Now, many things can happen. Aside from you crashing into a car that's causing an accident, you can hit someone. Many things can happen when you are distracted. So for your safety, as well as you reducing costs for yourself, you have to what? Drive safely. So you keep your eyes on the road while driving and look around your surroundings while walking to and fro the patient's home. So when you are going to the patient's house, you're coming from the patient's home, You look around the surroundings. Understand your environment. Do not carry purse or any large amount of money, or you wear expensive jewelry, expensive rituals, expensive chain and everything, or you make targets, but you make yourself a target for thieves. And if you must carry a purse or belongings, hold them securely against your body, like hold them tight. In the olden days, our mothers used to do some funny attitudes. We criticize them, but then trust me, they are trying to put safety first. You see them carry a bag, like what's it called? That they are scared. We now have an inner pocket. That inner pocket is where they will now put their money. Why? Because nobody will just come and you can't just take money from there. You see them tying money in clothes, tie and make knots or knots, make it just to keep their money safe. So do everything you can. Now we are past that era. But the best thing is if you must carry purse, hold them together, put them in your hand, like the way guests of nowadays, do their stuff. Just hold them securely. Carry your keys in your hand so that you can quickly unlock your door. In case of anything, God forbid you are being chased, your key should be in your hand. You can quickly access the door, unlock, go in, and lock yourself in. Park in well-lit areas and try to park as close to the patient's home as possible to reduce walking time. And if you feel very unsafe, leave the area immediately and go to a safer location. Then you can call your supervisor, for instance. If you feel safe, if you feel unsafe, don't start thinking of how to call 911, how to call your supervisor, how to call the police at that place. Look for a safe place immediately. When you are safe, call for assistance. Now, how do you get yourself safe from pets? How do you put yourself safe from pets? Pets, we know what pets are, like the dogs and the cats that we keep at home. So some patients may have pets in their home. You must find out prior to going to the patient's home for their visits. If they have pets in their premises. So you ask the patient how their pet is around strangers. So if the patient says that the pets are aggressive or do not like strangers, home health aide or personal care aide should also inform their person and seek direction from him or her. So ask the patient to place their pet in a secured area during your visit. Why? Because you are at the risk of us getting bitten by a pet, by a dog especially, if you don't do so. So when being introduced to a pet such as a dog, you should remain calm. Home health and personal care aide should always allow the pets to become familiar with them. For dogs who get at least fine, they don't freak out at strangers, they don't get too aggressive as strangers. You can learn to be their friend. So you allow the pet to be familiar with you. Then do not begin petting him or her before they become acquainted with you. A dog, you don't know if a dog is going to be aggressive or not. You just want to tap or pass the head. You can bite you. So I'll be sure that the dog is acquainted with you before you try to pet him. Then some pets are more frequently and accepting of strangers. So they are more friendly and accepting of strangers than the other. So an example of what dog attack. So while walking to and from the car, home health or personal care aide should always be aware of pets in the neighborhood. Not just your patient's pets alone, also pets in the neighborhood, because there can be loose dogs or stray dogs. They can attack you. So when you happen to fall in this position where there are stray dogs or loose dog, try to stay away from the dog. But then do not start panicking or running. So try to be calm and think of what next to do. So a home health aide or personal care aide should cross the street or return to their car if they are concerned about their safety. If you see that going forward will be harder than going backward, please step back and contact your supervisor as to what to do. So if a home health aide or personal care aide should receive a dog bite from any dog, now what do you do? Out of everything now, you got bitten by a dog. First thing to do is to run cold water over the area of the bite for several minutes to wash away the saliva and the accompanying bacteria. Then you don't squeeze the side of the bite. Don't squeeze it. This pulls the bacteria inside the wound. So inform the supervisor of the incident and you seek medical attention if necessary. Of course, it's necessary. So you seek medical attention. Obtain the identifying information about the dog and the vaccination records, so such as maybe the rabies vaccination. So if the vaccination is up to date, then you probably have nothing to worry about. But if the vaccination is not up to date or the dog never had any vaccination, then there is a lot to worry about. You have to go for what medical checkups and as well as medical treatment to help yourself prevent what the rabies virus. Then of rabies disease. So if the pet is not up, if the pet is not up to date with vaccination, home health aides must, or home health aides or care, personal care aides will need to get rabies vaccination when they seek medical treatment. So how do you do transportation safety? Transportation safety. You know what transportation is? So how do you transport yourself safely? It's important for home health aides or personal care aides to stay safe while driving to and from the patient's home. So you follow these guidelines for transportation safety. Number one, be familiar with the roads and stay away of surroundings. And stay aware of what surroundings. Be familiar with the roads and stay aware of surroundings. How do I mean? There are places you will be going for the first time. Why? You are allowed to be new, but learn fast and become acquainted with the surrounding as fast as possible. So become aware and familiar with the roads. Have directions and map handy. Even if you don't know where you are going, follow directions, follow maps. Ensure there is always enough fuel in the car. It will help to prevent unwanted stops in straight places. Imagine you're going to a place again for the first time and you don't have, you know, you're not going prepared, and your fuel finished or got exhausted in a place where there is no network and you're in a bushy area. Trust me, it can be very, very, very frustrating, like devastating. So if using your personal car, ensure it is in a good operating condition. Keep up to date with your annual inspection, and keep insurance and registration materials current and in the car. Have a spare tire, have a spare plug, have things duplicate. So in case one runs out or one stop functioning, you have what? You have another to work to replace it. Ensure that the tires are inflated to the appropriate pressure and obtain vehicle maintenance on a regular basis. Know how to drive in uh, inclement weather. This is in bad weather. If you don't know how to drive in bad weather, please don't move. Even in a weather that is too bad, there's some weather that they will advise you not to move. Please don't move. But then there are weather that still allows some particular type of movement or some amount of movement, but you need to know how. Because you know how, so you must know how to move in a bad weather. And this is an example of driving safely. Another thing is to drive the appropriate speed limits to prevent accident and tickets. In civilized countries, if you speed above the limit, you will be chased by police officers and penalized for it. But aside that, if you overspeed, you can get crashed and even die or develop a serious medical condition. So drive with the car's doors locked. It is, don't even rest on the car door while driving. But secondly, make sure that the car door is locked. You never use a cell phone while driving. Avoid distractions or limit talking and even limit music. Always wear a seat belt. Ensure other car occupants wear their seat belts as well. Then remember that there should be no children under the age of 12 riding in the front seat. All children must wear seat belts in the car. And child safety means that the child safety seat must be used with children under 8 years of age. So you inspect the child safety seat frequently to ensure that it's in good condition and working order. So make sure that you know how to use it. And if you don't know how to use it, you ask the patient or supervisor for instructions. Never ingest alcohol or drugs prior to or when you are driving. So we have come to the end of the module 12C. So just a brief recap on what we discussed so far. We talked about personal safety being the topic of the module 12C. And we introduced ourselves to what personal safety is. And I made mention of something that as personal care aids or home health aids, our safety comes first because our safety determines or guarantees the safety of our patient. Good. So if you don't take care of yourself, then you can't take care of another. It's practically impossible to not being able to take care of yourself, and as well as that, you are handling and taking care of others. No, so your safety comes first. So what are the things that we must do? We make mention of a lot of things. Avoid distraction. Don't listen to music. Know where you are going. Then also avoid pets. What to do when pets attack, and how to avoid those pets, and how to understand when to return when the environment is very unsafe. Then we mentioned transportation safety, about knowing where you are going, knowing the road, go prepared, don't go distracted, and also do not allow children of underage, like under 12, to be riding the front seat. And the safety seat belt for children of 8 years and below should also be monitored and inspected. Generally, inspecting your car, inspecting everything, just doing everything possible towards to maintain safety. This is how to keep yourself safe. And finally, when we're able to adhere to all this, we are not just helping our patients. Remember, it is your personal safety. And when you get hurt, you will suffer the pain as well as the bills, healthcare bills. So it is safer and cheaper to go slow and safe than to go rugged and fast. So fast, the slow and steady wins the race. Sometimes fast and furious don't get to their destination. So you have to be careful while transportation, as well as every environmental circumstances you find yourself in terms of patients. Always keep this in mind. PSF. Put safe first. Don't forget that word. PSF. Put safe first. So safety comes first in anything you do. Thank you for your time and enjoy the rest of your day.